Hey guys, this is Manu, Kalia, physical therapist and herbalist. So I got a unique video for you guys today. I'm out here helping someone recover after a total knee replacement surgery. But what's cool about this particular surgery is that it was a minimally invasive total knee replacement procedure. So which means that the incision site is much smaller, there's much less trauma to the local tissue, and the recovery times are much faster. So it's a cool opportunity for you guys to check out not only what the surgical site looks like and a couple of techniques that I'm going to show you. We're at 5 days post-op, so basically 5 days after the surgery. Okay guys, so here is the total knee replacement. And you can see the incision site is much smaller than the traditional incision, which often goes from way up here down to here. It's only 5 days post-op, so there's still a fair amount of swelling, but not bad at all. And the incision site is healing very well. Even the thigh, the swelling is starting to subside. Some bruising, which we expect even at this stage. So the big thing to focus on in the first at least 7 to 10 days, if not even longer, which is a much more conservative approach, is to focus on soft tissue mobilization. So massage, some myofascial release to improve the mobility, or actually maintain the mobility of the knee. Our expected was between 110 and 120 degrees of bending and full knee extension, which is straightening. Or at least as good as the other knee, if the other knee is close to normal range of motion, right? So that's the goal, for us to maintain that or get to that point as soon as possible. Now, after this particular surgery, even on day one post-op or the day of post-op, there was full range of motion with bending as well as extension, so which is excellent. And so the goal is going to maintain that mobility. We have limited the amount of walking and loading and excessive bending, straightening, or strengthening exercises. So the primary goal should be to reduce the swelling, heat, as well as control the pain. So if those things are under control, then the range of motion is going to be maintained with soft tissue mobilization, and then the strength will come back eventually, right? Often with the traditional ways of treating these issues, right away people are pushed into a lot of walking, weight-bearing activities, or excessive forced bending, extension, all sorts of things, and that can often irritate the joint further and cause more swelling and pain, requiring more medications and slowing down the healing process. So the results we have gotten have been great. One is the surgery was, as I said, is minimally invasive, and the second thing is having a much more conservative approach. So I'll just go over one simple range of motion bending exercise, which is done a bit differently than the traditional way of bending the knee, and then with some soft tissue mobilization to see what our results are going to be. All right. So what we're going to do is, with the bending, what I'm going to focus on is taking the hip out into abduction, external rotation. So traditionally, a lot of the bending stuff is done is just bending the knee straight back, right? Even with this, he does really well, okay, at 5 days post-op. But we get even better results if we get him out into some abduction, hip abduction, and external rotation. So which makes it a lot easier to work at slowly getting that knee bending. Now, I might take him phase by phase and have him hold that position and work at doing soft tissue stuff, working on his adductors, which are often very tight, right? Working on the quads. Okay, and I'm not cranking on things, I'm just gently holding him there and working and doing soft tissue mobilization, right? Possibly even some retrograde massage. So just gentle. All right, so not only the adductors, I'm going to go on the quads, I'm going to go on the medial side of the knee. So as I'm working on these things, I can slowly get him to start bending, right? And as I do that, I also bring him out into hip flexion, abduction, and external rotation. So which puts more slack in a lot of those tissues, makes it easier for him to start bending that knee. Now I'm working more on the outer aspect of the thigh, so working on his IT band. So now I'm showing I'm not spending too much time there right now, but normally I'd be spending 5-7 minutes in each position, each tissue, and slowly work on all those tissues while I'm maintaining that position. Now you can do some oscillations, and I'm holding him here if he's not comfortable holding that position. But as he gets more comfortable, and now if this is too much, I can always have him bend the opposite knee, which makes it easier for him to maintain that position, right? And now I can bend that knee a bit further. All right. So now I can gauge it with if this is in line with his other knee, which gives me an idea if he's going to get the same amount of flexion of that knee as this knee. So as this heel comes in line with the other knee, and then I bring the leg back up, it'll tell me that we have attained the same amount of knee flexion as the other side, right? So once again, I'm just showing you guys quickly as to how I would work on this in that position. Do soft tissue stuff here, do some oscillations. Normally I'd be spending a lot more time there working on his knee. And I have him take some deep breaths and relax. Try to work at relaxing that tissue because he's still holding that, so I'm going to have him just let him rest on my knee as I have him just relax and so very gentle, nice and easy. Also, you guys can see that this particular surgery, there are no staples, there's just glue that's used. So again, you don't have to get the staples removed at around 2 weeks or so. There's less trauma, a lot easier. And I hang out and I get him back a little further. Now he starts to feel it more, so I have him relax and I have him hang out there. Right? But he's got good amount of range even in this position. So I might just work there. Work on his quads. Okay, and now we're gonna work at, just to show you guys, I get him back into knee flexion. And he's relatively close to his other knee in terms of his range of motion. And here, so just so you guys can see, very close to the other side in terms of his knee flexion, and quite a bit of knee flexion, and only at day 5. Okay, so hope that was helpful.